This video is related to the shoulder relocation techniques. There are three techniques for the shoulder relocation: leverage techniques, traction techniques, and the scapular manipulation. Leverage techniques include the cocker, milch, and the external rotation. This is a picture showing the cocker technique for the shoulder relocation. Simply, there's the first step is the traction with the external rotation of the arm, then followed by the adduction, and it's followed by the internal rotation. What are the steps of cocker? Simply, they first do the flexion of the elbow to the right angle, then traction in the line of the humerus, external rotation of the arm, and the external rotation of the arm. This brings the head of the humerus to face the forward. The elbow is pulled across the body. This adducts the humerus and this engages the humeral head. And the last step is the internal rotation of the arm. This lets the humeral head fall back into the glenoid cavity. And there are few complications of cocker method, the nerve damage and the fracture of the humerus. The other technique for the shoulder relocation is the milch technique. This can be done in the supine position. First, externally rotate the arm and abduct the patient arm. When the arm reaches the overhead position, as already shown in the picture, the elbow is extended and apply the general traction, and then manipulate the humeral head over the glenoid labrum. There are 7 types of traction technique: the Hippocratic method, Stimson's method, Madsen's traction, the counter traction, Spasso technique, snowbird reduction technique, Eskimo technique, and the Mann's method. This picture is showing the Hippocratic method. In the Hippocratic method, you have to keep the patient in the supine position and then grasp the affected side at the hand and the forearm. Stockinged heel of the surgeon is placed in the axilla. This acts as a fulcrum whilst the arm is abducted. Now come to the Stimson's method. And Stimson's method usually required the powerful analgesics before starting the procedure. And we have to keep the patient prone on the table with the affected arm hanging down in the forward flexion. The sandbag is placed under the clavicle on the affected side, and the weight is applied to the wrist on the affected side. The spasming muscles you eventually relaxes and the joint normally reduces spontaneously. Now come to the Madsen's traction counter traction. In this technique, the traction is applied to the affected arm while the shoulder is in abduction position. An assistant is applied firm counter traction to the chest using the folded sheet, and the surgeon can rotate the shoulder internally and externally to unhinge the dislocated humeral head. Now come to the Spasso technique. In this technique, we have to keep the patient in the supine position. The affected arm is grasped by the wrist and the distal forearm and gently lifted vertically and applied the gentle traction. The shoulder is then externally rotated and the reduction usually occurs spontaneously. Pushing the humeral head back into the position may assist while maintaining the traction. Now come to the snowbird reduction technique. In this technique, the patient has to sit in the upright position as straight as possible. Assistant applies the pressure on the opposite side with their arm clasped around the patient chest into the axilla. The affected arm is flexed and at a 90-degree and stockinite is placed around the proximal forearm. It's twisted once so that the surgeon's foot can be placed in the distal loop and the firm downward traction is usually applied. Surgeon free hand are used to apply the rotation or the pressure as needed until the reduction is successful. The other technique is the Eskimo technique. This is usually done in the lying position with the non-dislocated shoulder on the ground, and the two people now lift the arm by this dislocated arm, holding into the distal forearm or the wrist, keeping the opposite shoulder suspended. Reduction is noted to occur usually within a few minutes spontaneously. Now come to the Mann's method. This is usually done in the upright position. The surgeon stands behind the patient and insert their flexed forearm into the axilla of the affected shoulder. The surgeon free hand is placed on the flexed forearm of the patient and gentle traction is applied. Surgeon's forearm pulls into a proximal and the lateral direction and levers the humeral head into the glenoid cavity. Last technique is the scapular manipulation. In this technique, we have to keep the patient in the prone position with the affected arm hangs vertically over the edge of the table at a 90-degree forward flexion and externally rotated. And at the wrist, 5 to 10 pounds of weight is usually applied for the traction. The patient arms begins to relax and the reduction is then attempted by pushing on the tip of the scapula medially with the rotation of the superior aspect of the scapula laterally.